So I'm Dr. Emily Kirkpatrick and I'm the Executive Medical Director within the Calvary-Medibank Joint Venture, and I'm also here today as a Board Director of Southern Adelaide Local Health Network.
Amazing. So as a Board Director of the Southern Adelaide Local Health Network, you just sat on one of the panels. Can you tell me a little bit about what you were talking about and the discussion that you guys had?
So it's very exciting to be part of the healthcare. What do we expect over the next 15 years to 2040? And a focus for us, and we had a number of different panel members, including the CEO of IHACPA, was talking about what do we need to do around funding and system reform to ensure that we're meeting the equitable needs, particularly for our multicultural communities. And so one of the areas I focused on was around disability. And we know with the recommendations that came out from the Royal Commission last year was there were 15 recommendations for health services. And that included both recommendations around education, so education for GPs and primary care practitioners, but also ways that we can help bridge the gap, because we know that individuals living with a disability, in fact, have 2 decades shorter life expectancy. So plenty of work we can be doing as a health service. And I was really excited to be able to talk through around what we're doing as a board, but also more broadly, where there's opportunities for us to really focus in on our communities and ensuring vulnerable community groups get the support they need in our health services.
And what were some of those areas that you were focusing in on today?
Yeah, so an exciting area that we're sort of looking at more and more is around virtual and digital technologies. So we know, for instance, the virtual hospital that we run through the Calvary-Medibank Joint Venture has now delivered care to 220,000 patients across the country and more than 12,000 patients within South Australia. Now, a focus within that is how can we support individuals who do much better off receiving care within their home? So we deliver acute Tier 1 activity whereby someone would be otherwise admitted into an inpatient bed can receive that care in their home. And one of the factors we sort of work towards is, well, what can we do for the disability sector and particularly supported independent living? What can we do around digital initiatives and virtual care? So we're very proud to deliver care for those particular individuals, and we adapt that care and make sure that it's precision-based and it's tailored for what it is that individual needs. So on the panel today, we were talking around what does the future look like, and virtual technology, virtual hospitals, how we can deliver that acute care to someone who doesn't want to come into a hospital or someone who's better off receiving that care in their home. I think that's what's most exciting about the next 15 years.
Yeah, absolutely. I would agree with you on that. My experience is working rural and remote as well. So I love that we're moving into this digitally enabled space where we can make health, it's more equitable and accessible to our regional and remote areas of Australia as well. So it's some great examples that you guys are putting forward in South Australia. What are some of the takeaways from the rest of the panel that you insights that you gained from today?
Well, we definitely had funding conversations, and having the IHACPA CEO, was really important for us to sort of unpack what does this look like. We know the Independent Hospital Pricing Authority now has aged care as part of that, and we had a discussion around, well, what does private health insurance look like over the next 15 years? What does primary healthcare look like from a funding perspective? And will there be a national body to support what that needs to be as part of the reform piece? So, certainly my background as a GP, we know that primary care is not sustainable the way it is. And so a real takeaway that we sort of all agreed on the panel was there has to be change to make the system sustainable. And I think one of those key areas that we as a Commonwealth and from a national perspective, create change in the funding models. I mean, funding can be boring to many people. We know clinicians struggle with how hospitals are funded and the activity-based funding models. But we know that if we're going to have a sustainable healthcare system where we spend 10.8% of our GDP on health here in Australia, we've got to be smart with how we use the money. So for me, the take-home was we've got to all come together collectively and look at how we fund the broader healthcare system, including the private health insurance space, primary and community care.
Yeah, brilliant. Well, thank you for your time today, Emily. We look forward to seeing you again soon.
Thank you so much.